Hi friends, in today's class we will discuss nodule at the limbus. So what is limbus? It is a transitional zone between the cornea and the sclera. So between the cornea and the sclera it is the limbus, right? So what are the uh, differential diagnosis or the causes of a limbal nodule? So we can remember it as a mnemonic, that is cat dinner. So remember this mnemonic and we'll know what each of it means. So first we have C, that is congenital. Inflammatory, sorry, A is allergic. T is for traumatic. D is degenerative. I for 2, that is inflammatory. Then we have nutritional. Neoplastic, and E, that is dinner, and R rest or miscellaneous. So now we'll discuss each of the entity in this. So coming to the congenital causes, we have dermoid, dermolipoma, and raised nevus. So what is a dermoid? It's a yellowish white mass, consists of epithelium, sebaceous glands, and hair, and the treatment is excision. Dermolipoma is a soft yellow movable subconjunctival mass. This is a soft lipoma means it has adipose tissue also, no? So it is a soft yellow movable mass, and it has adipose tissue and dermis around. It is associated with golden hair syndrome. The nevi, they can be either flat, raised, gelatinous, brown, black, and they have tendency to grow during puberty and pregnancy. Some may undergo malignant change. Treatment is also excision if it grows more. Coming to the allergic causes. The allergic causes include phlycten, VKC, the limbal form of VKC, and ophthalmia, nodosa. Yes. So what is a phlycten? It is an endogenous reaction to tubercular protein. It is a pinkish white nodule which is surrounded by congestion, causes photophobia, lacrimation, and the blepharospasm. It is treated by steroids and treatment of the cause. So VKC, we know there are multiple nodules in the upper limbus, and there are also superficial spots, and there is ropey discharge, and there can be recurrence. So we know regarding that it is more common in children and young adults. So the limbal form of VKC. Then coming to ophthalmia nodosa, it is a granulomatous reaction to caterpillar hair. We'll discuss this in a separate class, all these things, but for exam point of view, I'm just giving a brief discussion regarding each of this. So the treatment of this is steroid or excision. Coming to traumatic causes, we have episcleritis, and it is inflammatory, not traumatic. So in the traumatic causes we have granuloma, implantation cyst, as well as staphyloma. Coming to granuloma, it can be formed after a surgical wound, like after squint or pterygium surgery. So treatment is with surgical excision. The implantation cyst or retention cyst is due to some object which is implanted into the conjunctiva. So it produces whitish, a transillumination positive cystic lesion in the eye. Coming to staphyloma, as we know, for staphyloma to be at the limbus, it should be either intercalary or ciliary staphyloma. And we know it is most commonly due to trauma and all. Okay, so this was regarding the trauma. The CAT is done. Coming to D, that is degenerative. We have pterygium and pingecula. As you know, pterygium is a triangular mass of vein-shaped subconjunctival tissue encroaching upon the cornea. Then, so pterygium, the cystic type of pterygium is appearing as a nodule at the limbus. Then pingecula is a yellowish patch on the nasal side of limbus, which occurs in the elderly people, and it is a degeneration of subconjunctival tissue. Then coming to inflammatory, we have episcleritis, scleritis, and in the inflammation plus infection category we can take it as a cysticercosis. So episcleritis, it is the inflammation of the episcleral tissue, and it appears as a pinkish elevated one. So it is usually occurring in cases of gout, rheumatoid arthritis, and endogenous allergies. So here we have to give either topical steroids for the treatment, NSAIDs and indomethacin. Coming to scleritis, it is a inflammation of the sclera. It can be either nodular form or diffuse form. So the nodular form is the DDs for limbal nodule. So it is fixed to the sclera. It has pain and uveitis. It is usually due to collagen disorders, and the treatment is steroids. So cysticercosis is due to parasitic cysticercosis cyst. Okay. Then coming to nutritional, we have vitamin A deficiency leading to bite spots. Then neoplastic, so bite spots are silvery white, foamy lesions, usually in the temporal limbus, which is seen in vitamin A deficiency. Then now coming to the neoplastic ones, we have squamous cell carcinoma, papilloma, and primary melanoma. So papillomas are usually benign polypoidal tumors. They can be either sessile or pedunculated. They have the tendency to convert into a malignant lesion, and they can be treated by surgical excision. Squamous cell carcinoma is a cancerous lesion, as we know. It is flat, granular growth which invades the underlying structures and requires early excision. Primary melanoma can be in the nodular form, either pigmented or non-pigmented, and the treatment is excision. And in the miscellaneous conditions, we have post surgeries, that is a filtering bleb, which occurs after trap surgery. But so these were the DDs of limbal nodule. It is a very important question. It takes a lot of time to collect and gather information and present it in an understandable and easy to remember way. So I request you all to subscribe to my channel. Thank you.